Hello guys, today topic is emetics. Emetics are drugs that produce or induce emesis, vomiting. Mechanism of action of emetics. Emesis is the forceful expulsion of the contents of the stomach via the mouth, or sometimes through the nose. The vomiting reflex is stimulated by two centers in the medulla. Vomiting center chemoreceptor trigger zone.
How this CTZ is stimulated: tactile stimulation of the back of the throat. A reflex to get rid of something that is too big or too irritating to be swallowed. Excessive stomach distension, increasing intracranial pressure by direct stimulation. Stimulation of the vestibular receptors in the inner ear. Intense pain. Fiber stimulation. Direct stimulation by various chemicals, including fumes, certain drugs, and debris from cellular death. CTZ is stimulated by several different processes and initiates a complex series of responses that first prepare a He system for vomiting and then cause a strong backward peristalsis to rid the stomach of its contents.
Classification 1. Stimulants of CTZ: A. Apomorphine. B. Morphine. 2. Irritants of gastric mucosa: A. Mustard. B. Sodium chloride. 3. Both CTZ stimulant and irritant effect: A. Ipecacuanha. B. Digitalis. Apomorphine, semisynthetic derivative of morphine, acts as a dopaminergic agonist on CTZ injected IM/SC, not orally as dose required is high and acts slowly. Dose 6 mg IM, induces within 5 minutes, has therapeutic effect in Parkinsonism, not used due to side effects, contraindicated in respiratory and CNS depressants. Stimulates D2, D3, D4, and D5 receptors. Rescue therapy, for a patient who has severe, off period and is not responding to other medication. Subcutaneously injected. Therapeutic benefit begins in 10 minutes and lasts for 2 hours. Patients tolerating the test dose, but not therapeutically responding. Second test dose of 4 mg administered. If response, starting dose is 3 mg. Increased dose every few days. Maximum is 6 mg. In hypersensitive individuals, however, even subtherapeutic dose may elicit severe emesis and collapse. Vomiting is often accompanied by sedation. It should not be used if respiration is depressed. Large doses often produce restlessness, tremors, occasionally convulsions. Sometimes may cause hypotension, syncope and coma. Mustard, volatile oil. Formed as a result of a reaction between a glycoside and an enzyme in the presence of water. It is safe and easily available. Dose 1 tablespoon in water. Sodium chloride. Given orally. Withdraws fluid from the cells lining the stomach, thus causes irritation which causes reflex emesis. Ipecacuanha, acts by irritating gastric mucosa as well as through CTZ. It is obtained from the dried rhizome and roots of Caripiceae ipecacuanha, from which it derives its name. Commonly available as syrup. Dose 15 to 20 ml. Induce vomiting within 15 minutes. Although apomorphine is highly effective emetic, syrup ipecac is safer. Digitalis. Emesis is one of the most common symptoms of poisoning with the members of the digitalis group. All of the digitalis bodies are capable of causing emesis, but the different members of the group apparently show much greater differences in emetic than in cardiac activity with a given species of animal. Drug interactions. Emetics reduce their effects when used with activated charcoal. Adverse effects: arrhythmias, diarrhea, cardiotoxicity, drowsiness. Uses: acute cases of poisoning, except in corrosive substances poisoning or if patient is not fully conscious. Alcoholic intoxication. Removal of foreign bodies from the esophagus. Certain cases of paroxysmal tachycardia. Side effects: headache, constipation, and dizziness are the most commonly reported side effects associated with its use. List of drug-induced vomiting anti-cancer drugs. Apomorphine, chloroquine, quinine, diltiazem, emetine, right-pointing arrow, ergot derivatives, erythromycin, tetracycline, fluoroquinolones, metronidazole. Thank you.